everyone. I would like to welcome you to our Careers in Health IT session. This session is a collaboration of Rollins Office of Alumni Engagement and the Office of Career Development. My name is Semra Mostavak, and I'm Program Manager in the Office of Career Development. Next slide, please. The kind of things we're going to cover this evening, we will go ahead and start with the icebreaker activity. What is it in for me? What are you hoping to learn in this type of session? You're going to have a really great opportunity to discuss different types of fields and areas in this fastest growing field of health IT. What kind of questions you would like to have answered? So that's another thing we are going to discuss this evening. Next slide, please. So when it comes to health IT ecosystem, what is really health IT? Health IT is health information and data that is stored in growing electronic records that contains details about people, health, clinical information, and medical history. We're going to look into practitioners, how they can make well-informed decisions from data that in a way that they can improve patient outcomes. We're also going to look from the standpoint of administrators, how they can improve strategies and operations for health systems and organizations. Also, when we take into consideration IT specialists can improve interoperability for health data exchange between devices and users. And then to mention also federal agencies such as Centers for Disease Control and Prevention or FDA, we can make informed decisions to improve health policies and programs. So next slide, please. The next we're going to talk about is health IT ecosystem. Health IT truly expands into different other fields, and we can cover 6 different areas. For example, digital health. Digital health covers smart devices, cybersecurity, data tracking. We go into population health and consider disease management, data trends or patterns, and community outcomes. The next one that we really have as something innovative and new in the field of public health is telehealth. Remote monitoring, health tracking, and virtual meetings, especially at this time of COVID-19. Most of us are remote, so telehealth really comes as new innovative area and field. Public health IT that covers health IT policies, information regulation, and HIPAA compliance. The next one would be healthcare consulting, where we have project delivery, operation transformation, corporate strategies. And the very last area, cloud management, scalability, machine learning, and data infrastructure. So all of these together really make the health IT ecosystem. And they're all, very important to cover. So with that, I would like to let Mansi lead this discussion and facilitate the conversation this evening. Thank you so much for being here today.
Thank you, Sam. So if the participants can participate in the poll that which area of this ecosystem you're most interested in, just so that we have an idea about what you're looking at and for future sessions and how we can contribute to, this health IT series for you. So I'm going to end it. So it looks like about the majority, 36% is interested in population health. And then we have another 20% being healthcare consulting, followed by public health IT and digital health at 18%. And no one is interested in telehealth. Okay, so moving forward, I would like to introduce our 2 amazing panelists, Caroline and Margot. Just a short introduction to them. So Caroline is a manager at Brigham and Women's Hospital. She works in their strategy implementation team, and in her role, she also leads a team of internal consultants, and she helps in support of hospital operations. Previously, Caroline worked in the Brigham Digital Innovation Hub, where she led projects focused on fostering innovation and expanding the use of digital tools to improve hospital operations. She also has experience working in the US Department of Health and Human Services in the Office of National Coordinator for Health IT, known as ONC, and as well as in the Center for Disease Control and Prevention. She also served as a Presidential Management Fellow at the National Institute of Health, and she holds a BA from Case Western Reserve and, of course, an MPH from Emory University. Margot is the Human-Centered Design and Innovation Strategist at Children's Hospital Los Angeles, where she focuses on building impressive healthcare experiences for patients and families. Prior to Children's Hospital Los Angeles, she served for over 5 years in the federal government, most recently as the lead for internal innovation programs at the US Department of Health and Human Services and a program analyst with the Office of National Coordinator for Health IT. Thank you so much for taking the time to talk to us today. So as you know, compared to a previous session, we wanted a more organic approach, given that how both of you know each other so well. So can you also give us a brief background of what you studied at Rollins? How was your experience being at Emory Rollins, and how the graduate program has helped shape your career? We can start with Caroline and then go with Margot.
Sure. So hi, everyone. Great to meet you, and thanks so much for having us on this call. I'm so excited to be here with Margot, who I've known for many years, and I think first met at a Presidential Management Fellow career fair when she was looking for different opportunities, and we had a mutual Rollins connection. And just a little bit about me. When I was at Rollins, I studied in the BShe program, also took a lot of health policy classes, and worked part-time at the CDC in their Office of the Associate Director for Policy, which at that time was very engaged in a lot of national health reform efforts because that was sort of politically what was happening in the world. But also worked at the Carter Center in their mental health program, and took a lot of different classes and tried to get as broad of an experience as possible. But I really wanted to get a lot of research and theory experience, because I found myself interested in sort of behavior change and system change, and found myself thinking about public health in a more structured way. And maybe that's how my brain sort of works, but really enjoyed a lot of the classes that talked where you learned about, I would say, concepts for applying structure to a lot of public health programs and staffing them and supporting them, and do that a lot actually in my current role. So I'm very appreciative to that. And I know you've just go ahead. Is someone saying something? All right. I can just provide a little bit more context to what I'm doing now. As the introduction said, I spent many years in DC and moved there for the PMF program after I graduated from Rollins. Was working at the NIH, which was very, research-oriented organization, and decided that, I didn't really want a research career, or didn't want to really go for my PhD, and happened to have the opportunity to work on a CDC program that was focused on heart health, and was very engaged in sort of an app design contest related to heart health. And that was sort of my first, foray into health IT. And, I think had a really unique experience where I was working on that program, but also got connected to someone who worked at the Office of the National Coordinator for Health IT. And they, shared with me about a lot of the different opportunities that were happening related to adoption of electronic health records, and shared, and this was this person, actually, Margot, it was John Rancourt. I met in a coffee shop, and I basically talked to him about careers in health IT, and he said, in the next 10 years, this is really going to blow up, and you'll have so many career opportunities if you know about this, and you'll be learning so much on the ground, and convinced me to sort of come over. And didn't know that much about health IT, but spent 6 years learning a lot about digital health, and And when I decided I wanted to leave the government and do something a little bit more close to patients and on the ground, that digital health experience really helped me transition to a role in innovation where we were working a lot of improving, the patient and provider experience at our hospital using digital tools. And I'll just say right now, I transitioned to a new role about a month and a half ago on our strategy team. And my first assignment is working on patient vaccinations for COVID, which has been a privilege to work on and certainly a real priority for our health system. And I, am so thankful to have had a background in health IT to understand how the systems work. Everything we do is through our EHR, from patient scheduling to messaging to tracking of appointments to doses to on-the-ground communication. So I'm so thankful to have had that experience and to be sort of working on it now, understanding how we can use digital tools to be, more effective, and also learning that, sometimes you don't need a digital tool, and for certain populations, it's not the right approach. And I think that's also been a really eye-opening experience as well.
Thank you. Margot, would you tell us about your experience?
Sure, yeah. Again, just to echo Caroline, it's wonderful to be on this. Thank you so much for organizing this, and it's wonderful to meet you all and be on this call tonight. So again, my name is Margot Akazawa, and I feel like I've kind of in the footsteps of Caroline. So you'll see a lot of kind of similarities in our path and our stories. But I also am a Rollins alum in BSHE and behavior, and I focus more on behavioral science was my concentration. I actually got my first taste of health IT was actually at Rollins. So during my first year, I got to intern at CARE International and was working on a large program that they were working on around mHealth, so mobile health for low and middle income countries around maternal and child health, particularly seeing ways in which they could provide education to mothers, before they had their, before childbirth, to give them information and diving into also how to use mobile phones to really deliver that information, now knowing that so many people across the globe and have mobile phones now, and it's a really great way to be able to deliver education and content. And so that was really my first taste, and I just fell in love with it, to be honest, because it just felt like a really powerful way to be using current new tools and technologies to really make an impact on public health. I think it also really, from undergraduate, I have a degree in anthropology, and so it also tied in this piece around thinking about, and my interest in behavioral science, in that we got to really look at, how do you implement these things for different cultures, for different people, for different backgrounds. It's not as simple as just saying, here's a new app, or here's this mobile phone with information on it. What we learned was in talking to, mothers in India, that they had to, for example, the messages had to be spoken. They couldn't be written because some of the communities we had low literacy rates. They also had to be told by like an elderly grandmother. The voice of these messages had to come from that, because if they were in a male's voice, the male would, sometimes their husband would be very suspicious about, why are you getting these messages? And what is this? And so I think there's just all this other nuance that you can bring to health IT. And I think that's really the value, I think, of this background in public health and the education that I got at Rollins that I'm really that I use every day, is just that, Rollins really gives you, in many ways, like a multidisciplinary approach that you're learning from, for behavioral science, for example, you're learning about different theories in health education and behavioral science that come from psychology, come from all sorts of other anthropology, sociology. You also are learning too, from your colleagues and from your, from your class, from different backgrounds, who are in, biostatistics or in epidemiology or have a focus in health policy. And what I have found really valuable is, especially in health IT, you're going to bring that public health lens to the table. That often is sometimes, surprisingly, can be sometimes missing from that table. You might have we've often, and Caroline can probably comment on this as well, of that, we were, when I moved after Rollins into government, we would often be at tables where it would be just health informaticists, people who are really steeped in, how cloud architecture works and how, this new standard is using, but might not have that perspective from the public health lens on seeing sort of how would we, how does this affect, the population levels that we want to see? What is kind of the other data that we would want to be collecting? How is this going to be not only implemented into the workflow of the providers, but also how does this get translated to patients? How do patients and families get involved in this? And so I think that's just a really powerful lens that all of you can bring to health IT, and that is still one that is very much needed, especially now as we move more into, especially with COVID, move into more digital health solutions and other more virtual and digital technologies. So just to say, Rollins was really my introduction to that. And I think I still use a lot of the core lessons and things and classes that I gained at Rollins even today.
Sorry. Okay. Thank you so much. I'm in my last semester and I'm trying to think like where would I probably use some of the skills and some of the lectures that I'm learning now into the future. And listening to both of you makes me feel better. Like, okay, I can use all my skills I learn here in my job. So I realize that both of you have a history in innovation. And so if a recent graduate doesn't have, like, for example, Margot, you had the experience of working with CARE, and then, but with Caroline, you had the whole thing when you were working with, with your EHR and everything. But if someone who's graduating now and they don't have any background in health IT per se, how do you think, what are the roles that they can work in, or what are the skill set that they can probably work on right now when we're in school, so that will help them when we graduate 4 or 5 months, or even for first years when they graduate next year? We can start with Margot and then go to Caroline.
Sure. Yeah, that's a great question. For starters, I think just to say that, like, the fact that you're attending this call is a first step, right? It shows that you're interested in health IT and wanting to learn more about it as a field. So, that's a great start. I think the more you can learn about it, the better. Really, there's some great publications out, journals, newsletters, and other things that you can follow to really understand, what's happening in health IT, to stay, just to learn more about the space and the field, and getting a sense of areas that you would want to go into. So I think that's definitely a first step. I think too, when I was at Rollins, there wasn't any classes on health IT. I got most of my health IT experience really, again, from my internships. Later on, I was able to do my thesis more in health IT, focusing on looking at creating a mobile app for patients with epilepsy. But, I think that was really something that I had to kind of bring into the work I was doing. So I think that's to say, I think it's, number one, it's great to see that there's, since that time that you guys have this series and there's a lot of interest, and I'm sure there's probably more focus on classes in that. But I think that there's so many other skills that you gained at Rollins and through your public health education that, might on the surface might not seem like health IT related, but actually can be really powerful for future health IT careers. So, in my current work, for example, I do a lot of qualitative interviews. And so if you have qualitative or quantitative skills, like those things are really still really applicable skills for a career in health IT. Similarly, things like at Rollins, things like again, behavior, thinking of my BC hat on, theory. So understanding even just, some of those theories you'll still see come up, things like, just being able to see sort of how something like a new technology will get adopted in a market, or how can you convince providers who are still stuck with faxes and paper to be able to start to do this new approach, or even with vaccines now, right? Like, how can we get more people to, especially elderly populations or populations that aren't connected or have that experiencing the digital divide, how can we get them to sign up for their COVID vaccines when a lot of those COVID vaccine signups are being done online? You can bring in your public health expertise, understanding how people behave, how we even health education, how we communicate it to the to people, to your role in any sort of health IT role. So I guess that's to say, really, I think look at the skills that you can gain at Rollins, those skills-based classes, because those are going to actually take you a long way and really be applicable to the work you do. So I guess just two things. Yeah, like, continue learning more, and we're happy to, I'm sure Caroline too would be happy to share like a list of resources afterwards that you can share out with this group. But yeah, I think, a lot of the foundational stuff in public health and those skills-based classes can really still be really valuable for a career in health IT.
Thank you. That was so nicely put. When you said about all the theories, and I went back to my BC 500 class, and I'm like, makes sense. Caroline, do you want to tell us about your thought in this?
Sure. So I had no experience in health IT. I learned it all on the job. I think one thing that is super valuable is just a willingness to learn and engage and not be scared of technical terms. I hear so many people say, well, I'm not technical, or I don't know about this stuff, or this overwhelms me. And I think just having a little bit of like vulnerability and openness to learning something new will go a long way, because you'd be surprised how many people sort of shut it down, early on, to just say they're like, that's not for me, right? But the world actually, needs a lot of coders, but what they need in healthcare is people who can sort of translate what's happening in the health IT world into policies and programs. And a really good project management skills, I think, are very important. So on my team, we do a lot of project management for our senior leadership, and there's almost always a health IT component, but it turns into navigating, people and politics, and managing a project, and being able to sort of be flexible and adaptable, because nothing in tech ever goes right the first time. Things crash, systems, people don't behave the way you expect them. And so I think that just having that sort of ability to be flexible and adaptable and highlighting that is really important. I think Margot's point about behavior change theory is often overlooked. A lot of times you're trying to sort of convince people to try something new, and it's a lot harder than you might think. And I think there's an equity piece as well, where Margot was talking about, I think there's sort of two camps. There's the people who live in the world of tech and tools every day and don't understand why someone might not use it, or why even using something more simple could be a better solution. And then I think there's people who are a little scared of technology, so being able to bridge those gaps there. But, I think the equity piece is really important for our vaccine initiative. We're inviting people to schedule through their EHR, but we have a massive call campaign targeting high-risk neighborhoods and people living in high-risk zip codes to ensure that they get equitable access to the vaccines. So I think that is really important too. And then, I think a lot of tech is very structure and process oriented. So classes on like healthcare management, how does a healthcare system operate? What are some of the financial incentives? Some of that policy piece I think is really important too, because with any new technology or tool that you roll out, you have to be able to make a compelling case for why it's going to save you money, because the price tags are often really big. So sort of understanding like a little bit of that reimbursement model and like financial analysis, I think is important as well. And one other thing, like, I'm in Boston, so I don't know what it's like in Atlanta right now, but there is a massive need for people to work at these vaccine clinics. And even if you're just like doing weekend checking in and checking people out on the EHR, like that's really good experience. I know we just put out like a call, like a huge labor need call for people to do things like that. So there may be opportunities to volunteer or even get paid to do stuff like that. So I would say look in your networks and see if there may be something along those lines, because the healthcare systems are standing these up from scratch and often don't have the excess labor right now to help.
That's a very good point. So this also gives me a good segue, and I just want to have an idea. I think all of us, like, what's a day at work for you like? Like, what do you do, and how are you using your skills, and what's your 9-to-5 job, basically, as simple as that is. We can start with Caroline and then go back to Margot.
All right. Oh my gosh. All right. So let's think about this. What is my day like? Right now, it's all day, all vaccines, all day, every day. My job is kind of unique. We have a team of internal consultants that support our hospital leadership. And the way that our model works is, each person is assigned to support like a senior leader of the hospital. And so I manage a team of 4. And so each of my team is, staffed to a different area. I have 2 people working in pathology. I have 1 working in sort of supporting our OR. And many in our team are supporting a lot of like inpatient operations. But I have a sort of different role because I support ambulatory services. So all of our outpatient clinics. And I work with the VP who oversees them, and it's supposed to be 50% management and 50% supporting her, but recently it's been close to, I think we've agreed upon 90% of my time is on vaccine clinics. So my typical day right now is we start our mornings off very early with calls. And one thing I think that's really, interesting and unique is, I spoke a little bit about the like business of healthcare and like the financial interactions at play. And so one thing that COVID has brought about is the Brigham and Women's Hospital is part of a larger healthcare system called Mass General Brigham. It was formerly known as Partners Healthcare. And so our sister hospital, Mass General, and a few other like community local hospitals. And the challenges of COVID have been so immense on our system that we are trying to do things more standardized and systematically across our system. So thinking about things in a very like system-oriented way, instead of like every hospital does their own thing independently. And so we're still figuring it out, but a lot of my time lately is to support our system-wide approach to vaccines. So it's not just thinking about our hospital, it's thinking about the needs of the system. And so I'm supporting our IS work stream, in information systems, and our staffing work stream, and trying to figure out how to approach sort of these large scale problems of, setting up a vaccine clinic from scratch. Like, what are the information needs that are required? What are the staffing needs that are required? Like I said, the labor market for healthcare providers is basically tapped at this point. So how do we do this from scratch? Like, thinking about a lot of like key decisions, like, do we redeploy people? Do we invest in thousands of dollars of new technology to stand up these clinics? So thinking through a lot of like system level approaches to setting up these clinics, which went live this week, and it's going really well, and it's very exciting.
I'm glad to hear that, because I know you have your meetings in the evening.
Yeah.
Margot, do you want to give your shot?
Yeah, sure. What does my day look like? Well, yeah, so lots and lots of meetings. That's probably my day in a nutshell, is just tons of meetings and lots of emails. But to dig into that a little bit deeper, is that, so Caroline brought up project management. And so a lot of my role is actually doing some project management. So again, I'm at Children's Hospital Los Angeles, and we have a innovation studio here that I'm part of. And like many other innovation hubs or studios in different healthcare settings and systems, what we are is really a place where we can identify opportunities, problems, things across the hospital, as well as some other things that people are wanting to focus on and identify, what is the problem there, and thinking through what's the best solution to solve it. Are there technologies and innovations out there that could help us to solve this problem for us that we would want to bring on in the hospital, and helping to kind of accelerate that at the hospital level, as well as, what can we be doing more internally that, might not even involve a digital solution. Maybe it's just, again, innovation is, kind of three things. It's, people, process, and technology. And the technology is the easy part, the people in the process, getting everyone on board, working through the various processes of a hospital, just all the layers that you have to go through, the understanding of other things that have to be considered, such as privacy and security, how it would be implemented into workflows. All of that is so important with understanding, for the success of a new innovation coming into the hospital. And so, I have several projects ranging the gamut of, things around trying to improve our patient and family experience. So, things around like, how can we help people with wait times? Wait time's a big problem in our hospital, where people are waiting for hours on end before they can get seen at their appointment. What can we do around the hospital to make that wait time? Either can we reduce those wait times, and how can we make it even just a little bit more pleasant or more transparent about how long you have to wait? I'm also working on projects around, some more like social determinants of health. So we're partnering with community partners to establish these telehealth hubs in LA, knowing that a lot of our patients and families might not have access to the devices that they need to take a telehealth appointment, or the internet, or even a safe and quiet space to be able to take an appointment at home. So we're working with community partners to see if we can expand that access. We also have other random projects that come our way. So I'm also working on this yoga project. So like, they want to get more youths involved who have chronic pain, to use yoga to manage their chronic pain. So how can we do that in a digital way? So they really are ranging across all over the place, which is very exciting for me. I love having kind of that various different projects to work on. It really excites me. So that's kind of one of the things that I do, day to day, is really kind of managing those projects, making sure that a lot of times these projects are just the little, brainchild or the idea of a few doctors in the hospital, but they're doctors, so they're seeing patients day in and day out. They have other things on their plate. And so in order to actually see this become a reality, it often is reliant on the innovation studio, on my colleagues and others to really be that project manager, to really see it go through. Okay, are we, do we have the budget? Are we putting it through the right process? Is it getting reviewed? And finally, can we launch it? Another piece of my role is, so I also have a background in human-centered design. And so a lot of my role too is doing a lot of the front end throughout the innovation cycle, but a lot of it is some of it in the front end of really understanding what are the needs of our users, who's our end user, is this the right problem to solve, is this a problem, and asking all of those questions. And so some of my work too is a lot of interviews, so setting up interviews with our patients and our families, as well as our doctors and other stakeholders, focus groups, and then just observational research as well. So sitting in the hospital and seeing, what is it like for a child that's going to be admitted to surgery? What's that experience like? And is there something that we can put there to really help alleviate some of the anxiety for both parents and their child before they enter into surgery? So that's also that's probably the more fun part of my job, is really doing that, exploratory research at the start of these projects.
That sounds really interesting.
Margot, I have a app that I know, a company that talked to me at an event that have like a yoga app on demand. They have like real instructors. So I'll have to dig it out and give it to you.
Oh, yes. Let me know.
I can't say I took them like 100% seriously when I talked to them, but they actually said they worked, a lot of their clients were residents, because they had a schedule that was like, they had a yoga instructor available like at all times. So people could like get home from the hospital 11 o'clock at night and like have a real yoga session. So I'll have to dig it out.
Yeah. Yeah. And I think that touches on like another piece of this role. And I think in health IT as well, I think this is something that, we also did from our seat when we were in federal government at the Office of the National Coordinator, was just keeping an eye to like what's out there. Like there's just so much happening out there in this space that like sometimes it's just kind of like meeting with companies or like learning more about them and like keeping them in mind. And like most of the stuff like doesn't go through, right? Just because of like, doesn't fit with what you're trying to solve. Your hospital, there's all sorts of maybe security issues. It costs a lot, but you have to make those decisions. But, this space is rapidly growing, rapidly expanding. There's so many new opportunities now with like, natural language processing and like all this other stuff that's like making some of this, that is being applied to different areas. So, so that's also, I think, a big piece of this too.
I really like that both of your background come in innovation, and I was pretty curious on, it seems to me like you have a lot going on in a good way, but what's the start time? I mean, how long would you say from the start of a project to the end of a project? Because given that you've worked in the federal as well, now private hospitals, or more of a health system versus, when you're working with the government, like, how would you draw the differences between them? And now that you're in positions to really use your ideas into making them a big project for your hospital, like, how are you making that a possibility?
I'm happy to start. I think one of the big differences between working in the government and working for a hospital, there's two big differences. I think the first is in the government, you're operating at a very high level. You are like looking across the country, trying to assess needs, rolling out programs based on those needs or legislation, but it's a very top-down view. And so your projects are often big and long and well-funded. And, you might have to sort of navigate like political challenges or differences between states and, sort of differences in opinion of sort of like a national approach. But you're sort of at like setting the vision and a lot of times like sticking to it, I would say. In a hospital, it's just totally different. I mean, Margot and I have had this conversation, like we had the conversation when she first started. And we were basically like, there's no process. There's like 1 million people involved. The timeline's in like 2 days. So it's very much, I think, a crisis environment, even, before COVID. It's just how hospitals sort of operate. So when you're trying to sort of do like project management or other sort of project-based work, it's a little less secure, I would say. It's a little more we need this immediate fix, or it's we're going to try and do something long term, but like be prepared for interruptions. Like I'll tell you, majority of my projects that I worked on at the Innovation Hub were put on hold to respond to COVID. Our whole team was redeployed. And so just being able to like be very flexible and adaptable, I think is something that's just very important. And I think, you know, another challenge is too, I think like working in an expert culture where a lot of people you're working with are experts in their field. And there may not be as much of a, like, I guess sort of like system level approach. It's like a little bit more individualistic. And, you know, like thinking about people who've researched, you know, one thing their entire careers. And so sort of working within that culture to make sure that we're thinking about it from a lot of different lenses can be a little challenging sometimes.
Yeah, and like just to add to all of that, you know, so one, I mean, if you have your heart in service, like if you are in, like, I highly recommend federal government or looking into even state and local government. There's so many different opportunities that bring in this health IT lens as well as public health lens where you can contribute your skills to a really big mission. And I think, you know, I would not have exchanged that experience, you know, for anything. And so definitely, you know, we both were part of the Presidential Management Fellows program. That's a really great way to kind of get your foot into federal service, but there's so many other opportunities out there to be able to do that. But just to, comment with what kind of piggyback off of what Caroline said, you know, I think one of the main distinctions, and I think for me, you know, one of the reasons why I decided to leave federal government and wanted to do something more at the local and kind of really at the hospital level was, you know, federal government, like just like Caroline said, is really big. It's you know, you are way up here in terms of what you're working on, you know, whether it be a policy or a program. You know, a lot of times we would kind of complain that, you know, you're designing for a program or a policy for American 0 to 99. Basically, that's no longer a person or an end user. That's a population. That's like huge, right?
Oh, yeah.
And so it can be really hard to do some, you know, both really rewarding because your things have a really big impact because, you know, then you can see it actually being used basically, wow, like that policy piece that we wrote is now something that all hospitals across the US have to report to or have to meet. Like that's really powerful. You know, but at the same time, it can be a little frustrating when you see these opportunities to fix something, but yet not have that power to be able to fix it. You know, so for example, we at the Office of the National Coordinator for Health IT, we were working, you know, we were working on projects around how do we encourage have patients be able to get access to their health data. It's still really hard for them to get access to their medical records. A lot of times it's still on pieces of paper. A lot of times it's like fax and it'll be just PDFs or it's still just not digital in the way that we would love to see it be easily exchanged in the same way that we, you know, are able to see from our bank, you know, an immediate statement of how, you know, that, you know, I charge my credit card to, you know, to get takeout food, you know. But one of the frustrating things is, yes, we have this policy level that we can try to get hospitals to, but there was a lot of small things that just even things like, you know, having online forms that people could fill out. Like that was a basic thing that, you know, we were seeing that just a lot of hospitals still, you have to print out a piece of paper, fill it out, mail it, or sometimes even bring it in person with an ID to show that you're that person, you know, that I'm Margot asking for my records. And so we were like, oh, like this is so easy. Like just, we can make a fillable form, but yet that's reliant on the health systems, the hospitals, to actually do. And so, you know, so what I've been really like glad to have now and at the hospital level is, you know, really the chance to be able to design programs and implementations that are really focused on real, like I wouldn't say real people, but like, you know, on actual patient stories on like, okay, this is, you know, we're trying to design this program for 14 to 16-year-olds with this particular condition who experience this particular pain point when they come into the hospital. And then actually being able to see it actually happen in a very quick timeline. I mean, Carol and I were working on stuff that still is in process, I think, in federal government still, and so I think it's been really rewarding to have both of those lenses, to have that background in health IT, in policy, in federal government, but also pairing it with kind of this actually seeing sort of the nitty gritty and like when the rubber meets the road and being able to actually see implementation happen.
Wow. I do have more questions, but I know we're 14 minutes away from our end. But I want to open up the floor to people who have questions, or we can get into breakout rooms. Michelle, what do you suggest? Do you want to do breakout rooms, or we just open the floor to questions in the main room?
Why don't we go ahead and see if there's any questions to start, and if there's none for the greater group, then we can go into some breakout rooms. But let's give folks a chance to either type some questions into the chat or feel free to unmute and ask a question.
Hi, my name is Janice. I'm a second-year health policy and management student. This question is for Carolyn. I actually just moved to Boston from Atlanta, and you mentioned something about like vaccine clinics and some clinics looking for like volunteers or even like a small paid position. I was wondering like what website or are the positions on LinkedIn?
Yes. I'm going to put my email in the chat, and you can email me, but I will also include a link for the campaign that we launched to recruit people. So, but send me a message, I'll connect with you, but I'll also include the link for our campaign as well. But glad that you're here. There's not that many like Emory people here, so I'm glad to see them. I mean, maybe they are. I just like mostly moved here, and then there was a pandemic, so I haven't gotten out as much as I thought I would. But I'll send you the link for that as well.
All right, thank you. I appreciate it.
Hi, let me turn on my video. Hi, my name is Nayantara. I'm also a second-year health policy management student on the MPH track, on the healthcare management track. And I had a question for Margot. So I know that you work a lot with sort of the patient-facing technologies to enhance patient experience and sort of the patient family sort of engagement throughout the healthcare journey. I'm curious if you could maybe talk a little bit about how you connect sort of that side of health IT, sort of the patient-facing healthcare sort of clinic interaction side with translating that to health outcomes. I mean, do you sort of find sort of connections between that? Is that sort of a goal of a lot of your initiatives? And if you can maybe talk about that connection.
Yeah, no, that's a great question. So we do try to at least link it to some sort of outcome that we would like to see. So, and that can vary based off the project, but, we do try to have an outcome, whether that be, but not all of them are maybe clinical outcomes, right? I think that there's, some of them, it can be business outcomes. So things like, are we losing, hospital is an organization. So, are we losing revenue when we can't have, when people are waiting for so long to be able to make an appointment, or that they're not able to, or they have trouble finding their way to the appointment and then their appointment's canceled. So I think there's also some business decisions but again, that I think can lead up to healthcare outcomes, by missed appointments, delays in care. But, I think there's also some other outcomes that we look at as well. I think another piece too is, looking at some of those human outcomes too. Do people have less anxiety when they come in? Do they feel, that being seen as a whole person and listened to. I think those are also really big outcomes that we are wanting to explore and see. And so, we do try to build in a metrics process in our work. So either using existing data collection metrics, or trying to build out new ways to collect those metrics, either if it's a new app or some other thing like that, can we collect some information on end users and their behaviors and see if that can kind of translate to other to the outcomes that we're wanting to map to. We also, I guess to say is, the Children's Hospital Los Angeles is, we are a research institution. We have a lot of doctors here that are doing research studies, and so we also try to tie it to their research studies as well.
All right, thank you.
Mm-hmm.
If we can take one more question and then we can get into breakout rooms.
I had a question. So I'm in the middle of a job search process. I'm a second year, and I was just curious to see if you had any advice when you're looking at a new position. How do you kind of balance like the skills you want to continue to develop versus where you want to work? Do you have any advice for people who are kind of trying to figure out how to position themselves, especially early in their career?
I know when we look at candidates, we look a lot at, it's not so much about like the classes you take or the subject matter, but the, skills that you have, and can you speak to those skills in detail and like provide anecdotes and share, stories about a time that you've experienced a challenge or you've managed a project with a difficult stakeholder. So a lot of, I think, focus on the soft skills. I think a lot of employers, like a lot of job descriptions will focus on the hard skills, and you should certainly, look and see if you have them. But, thinking about the opportunity and the experience you've had that can position you for that is good. I also think, people sort of underestimate the, they're not really like hard skills, they're not really soft skills, but things like Excel or project management, just like little things like that I think when you're early in your career can sort of help give you an edge. And, positioning yourself as, sharing experiences that you've had working, even if it's on a group project and how you managed it. It's more about like how you speak to it and how detailed you can be. I would say, the more specificity you can provide, I think the better, because I think what sometimes hurts candidates is like a big cover letter or a big resume. Like, I want to know the details, and I want to know, the one specific experience in your cover letter that you think qualifies you for this, not just like a regurgitation of your resume, right? And I think, just like showing a little bit of passion too is important, because all these jobs get so many applications, and making yourself stand out, just understanding the hospital or the organization you're applying for and why you can sort of see yourself there, I think is really important. And another thing, I think a lot of people struggle with translating experiences into what the job might entail. So, I just went through, I didn't interview for a job for like 8 years. All my jobs were like through a fellowship and then like word of mouth, and it was like a very informal network. But I interviewed for my job in Boston, and then when I decided to transition, it was like a really rigorous interview process. I told Margot I'm like on interview 5. So I really like recently prepped for this, and a lot of those like behavioral interview questions are really, really important. I think people underestimate the detail with which we want the answers to that. And so looking online at sort of like common behavioral interview questions and just really preparing for that, I think is very helpful.
And just to add a few things, I think, one thing is, as you're looking at job descriptions, you don't want a job that looks exactly like you can do this in your sleep. You want a job that you can actually learn something, right? Like you want to grow. And so I think if you see a job where all of the requirements, like all of the description is like, oh, I'm already done that, or I'm doing that currently in my internship, like I would say like unless you have that interview and you can learn more about how you can grow or where those skills are that you can actually gain from it, like no, like look for something. You got you can do better. And then I think the other thing too is like you brought up location. I think now with COVID, like that's really so many more organizations are so open now, I think, to remote work. So I think that's really has changed the game for where you can go and what work you can do. And so, while yes, I think, and also knowing yourself and your work style, like if you want to, go into if you like interacting with people and being in that environment, you might want to choose something that will either have a chance for you to go back into an actual workspace, or a chance to meet your colleagues. And I think a final thing is just, I think Caroline touched on this a little bit, but when you go and interview for these jobs, I think it's also a way for you to interview them. And I think one of the things that I kind of dismissed early on, but came to really recognize as a big important factor in places that I've enjoyed working is like my colleagues. So, when you talk to them, if you get a weird vibe from them, or you're just like, there's nothing sinking here, like that's a really big tell as to whether or not you'll really enjoy working there. So I think that's just another thing to kind of keep an eye out for.
Yeah, that's a good point, Margot. There are some good resources for questions for interviewees to ask to assess workplace culture. And I think people underestimate the sheer hours that you spend with your colleagues, and the importance of a positive working environment. And so I actually used some of those tools recently for my interview, and it was really helpful because I felt like I got a better sense into sort of how issues were dealt with, or some of the common problems that people face. So I would encourage you to think about that too. I don't think I even knew what the term workplace culture meant, and I just was excited to have a job when I graduated. But there's more to it than that.
Thank you.
We're about 2 minutes away, so I think students can, if you're okay with it, they can connect with you offline instead of us getting into a breakout room. But thank you so much. This was such a wonderful session. I know I've learned a lot, and I'm sure everybody else did. On a parting note, if you guys can say in one word, what's the future for both of you? Where are you guys heading next? What's next on your agenda? Margot can go first.
Oh no. Oh man, that's a tough one. I think, for me, I just have such a my passion is really in improving patient and family experiences, trying to just bring more care to healthcare. Like healthcare is just so daunting. It's really scary. It's not easy for people, even people like us with health backgrounds, to even navigate. And, so I think for me, where I want to see, where I'm going is, trying to figure out ways to continue to do that, whether it be at leadership roles in hospitals, or maybe there's just some other paths in which to take that would allow for, just that chance to, again, bring more care to healthcare, and really impacting people's experience and the ways that they interact with healthcare.
And Caroline, what's your next step?
Next steps. So, I'm trying to think about it's hard when you're sort of in the day-to-day. It's very COVID focused environment right now. I think what I'm looking forward to is a lot of the things that happened through COVID, which was working in a more cross-organizational way, being forced to work with people outside of my, normal day-to-day, trying to figure out how we can make that part of just how we work, and not part of a crisis situation, and thinking about how we can engage more with, people who share a different viewpoint or work in a different area, and really bring that back to, sort of just becoming part of how we operate. And I think a lot of like academic medicine is very siloed.
Mhm.
So thinking about how we can sort of think beyond that and do more cross-organizationally. And so I'm curious to see if, I know our leadership is thinking about it. I'm curious to see if that would like bring new opportunities in the future, and thinking about, as someone who likes to sort of work in that manner, what could be sort of a next step. But I just started a new job, so I'm cool for a while.
I will email both of you in 6 months and see what's happening. But thank you so much. We had a wonderful session. I know both of you have shared your emails, so everybody who's attending here, please feel free to take them and connect with them. They're both really nice, and I enjoy working with both of you. Thank you so much.
Thank you. Good luck, everyone.
Bye.
Thank you.